Hi, my name is Joseph Anthony Jerez. I'm from New York City. I'm here at Swiss Medica, a stem cell clinic in Moscow, Russia. I am a patient, and prior to coming to Swiss Medica for stem cell treatment, I had a bunch of questions. So I'm going to go over the questions that people are curious about looking into getting stem cell treatment. I'm here with Dr. Alexandra, a doctor here at Swiss Medica, her specialty is anesthesiology. But here in Swiss Medica, she focuses on regenerative medicine. Now, what results can a patient expect from stem cell treatment?
First of all, if we look at the effects which stem cells can do, such as activation of regenerative properties, anti-inflammatory effects, immunomodulating, etc., we can expect with different diseases different results. Last time we spoke with you about general effects, and today probably we will talk about children, about autism. This problem is very actual for many families.
Yes, exactly. Now, keep in mind, this is our second video together, and in this particular video we're going to focus on autism. So please elaborate on your success rate with treating autism.
At the moment, according to our experience, it is about 85%.
85% success rate?
Yes, for children who has autism. And here we should clarify that if we take 100 children, 85% of these children will have positive dynamics. Of course, it's something individual. Some children can have maximum improvements or minimum, but still there are some improvements, some positive changes.
Okay, so basically improvement can vary from patient to patient based on their level of autism, their physiology, if they have other health problems, things of that nature.
Exactly, because the response for the stem cells therapy, it is something individual, and results, of course, are also individual. There are rest 15% of cases when there's no obvious effects, and even for these families, some trials proved that it's better to have some additional therapy, because there were trials when after 3 months period the dose with umbilical cord derived stem cells were done, and even each 3 months during 1 year. And even those children who didn't respond at the beginning, then after the second, third session of therapy, they had improvements.
Oh, okay. So basically, if the person being treated for autism didn't show improvement after the first infusion, you shouldn't be discouraged, because they can show improvement after the second infusion, the third infusion. Okay.
Yes, and as we discussed before, the improvements we can expect after 1 month till 6 months period. That is why when we are our colleagues, when they did their trials and did it each 3 months, it's to cover these positive things, to have opportunity for more improvements. Do you understand what I mean?
Yes.
Okay.
I understand.
Okay. And of course, the family should aware that it's really individual. The results are individual, and nowadays this disease can't be cured. But certain positive things the family can have with the stem cells therapy. And I'd like to tell you one very interesting story. The patient from Israel came to us. It is a boy. He was 5 years when he started the therapy, and he had all symptoms, typical symptoms of autistic child, such as repetitive actions, not following parents' commands and living in his own world. He had as well seizures. He took several anti-epileptic medications, so medication that could help with this problem, but even taking them, he had 2 cases when even it was problem with his breathing, and he was taken to the hospital. And the family, after the first treatment with the stem cells, his mother informed that the episodes of seizures stopped at the moment.
Really? He stopped having seizures?
Yes. So as we discussed, there are many effects of the stem cells, and obvious effect like activation of neuroplasticity in brain, and activation of new neuronal pathways, so-called synaptogenesis, more connections between neurons could be observed, plus anti-inflammatory effect, immunomodulation. All these things we can suggest took place.
Okay, now how did it affect his development, his educational development? Did it improve?
Yes, it's a very good question. Before the therapy, he went to special school because of this basic problem, and after the first treatment, his cognitive functions, ability to learn information, to cooperate with children improved greatly, and even his teachers at school informed about it, plus parents, of course. And at the moment, he finished his 3rd therapy, and now he goes to ordinary school.
Wow, from going to a special school for autistic children, now he's developing on a normal level, and now he's in an ordinary school with other students. That's great.
Yes, that's true.
Wow. Now, a question, is it safe to use stem cells?
It's quite safe. The percent of any kind of side effects can be for children. At the moment, we have experience of having about 25% of adverse effects. And it is mild fever that can last for 1-2 hours after the administration of the stem cells, IV, intravenous infusion, and then temperature goes back to normal.
Okay. Now, and specifically, when treating the autism, what source of the stem cells do you use?
According to our experience, and it is scientifically proved as well, that most effective results could be observed among children who took umbilical cord derived stem cells and placenta derived stem cells. Okay. They showed quite effective results, and the trials which were carried out with using of different famous skills, such as childhood autism evaluation checklist and others. So according to those parameters, children were assessed, and there were improvements with their behavior, cognitive functions, etc. That is quite promising, and to move further, yes, with treatment of these children.
Okay, now how are the stem cells administered?
For children, the way of administration is the only one. It is intravenous infusion.
Intravenous meaning through the arm?
Yes, inside vein.
Okay. Okay.
Yeah, and if you would like, I'll explain how it looks, yes, the details of this procedure.
Well, I think we've all gotten a needle. Everybody knows what it is to get an injection, because I'm a patient, so I know it's just a simple injection. Is it a painful procedure?
It's absolutely painless procedure, and you know, sometimes children can be a bit nervous, scared about even staying in a clinic, in a hospital. According to individual, the special things can be done. Even in bad cases, it can be light sedation. So,
so the child calms down.
Yes, and
because
then,
every kid is afraid of getting a needle, obviously.
Yes, not saying about adults even.
Yeah.
Yes. And so it can be done under sedation, and the catheter is inside vein, and then the procedure begins.
Okay. Now, let's talk about contraindication.
When we are talking about general contraindication, it is signs of cancer, or when a child or adult was diagnosed with this serious problem, it's not recommended to have the stem cells therapy because it can activate the process of growing of cancer.
So basically, it's contradictive to your overall health. If you have cancer, there's a good chance that it could multiply the cancer cells and progress the cancer even further.
Yes,
okay.
Exactly. And I'd like to add that we, before arrival to clinic, we are in touch with parents, and we say that it's better to come to clinic with a child when there's no signs of any acute inflammation or infection diseases, because then the effect of the stem cells therapy can be minimum. So
yes, because the stem cells can only do so much.
Yeah, then it will work with a problem, with the infection. It will help immune system to resist with this basic problem, but not with neurogenesis, activation of neuroplasticity, which a basic target, yes, for autistic children.
Okay, so what is the duration of the treatment? Like, say the child comes in to get stem cell infusions. How long does it take? The actual process?
The process can last for 30-40 minutes.
Only 30 to 40 minutes?
Yes, so when after the moment the infusion starts, yeah, and it is a child is monitored. It is pulse rate, blood pressure,
okay,
saturation.
by monitored, you mean that there is, and I already know because I'm a patient. By monitored, the doctor is saying that the doctor is right in the room monitoring you, and there's a nurse there taking your temperature, checking your pulse rate, just making sure that there are no side effects, and then you're not having an adverse reaction to the treatments.
Yes.
Oh, okay. Now, how long are the results saved?
If we talk about the duration, then we should say that for autistic children we have special program. And it is, for example, it can be within 2 years. We recommend children to come each 6 months period. Why it is 6 months? Because usually from, let's say, 1 month till 6 months, this is a time frame when we can observe different changes, positive dynamics connected with a child.
Now, as a patient with autism, to be specific, when do you normally start seeing improvements? After the first treatment, after the second treatment? When do you first start seeing improvement in the patient's conditions?
In patients' different conditions, the results can be different. When I spoke about our successful case, even after first therapy, parents observed these improvements.
Oh,
but,
so after the first treatment, parents saw improvement in their children?
Yeah,
okay, that's great. Yeah.
Now they continue their therapy. So last month they had their third arrival, and we expect their fourth coming after 6 months period again. And the family is in touch with us. They inform about changes that child has, and they send video regularly to us to see what things, yes, with behavior, with his communication happened.
Okay, so the clinic is still in communication with the patient even after they've had their infusion and they've gone back to their home country. You still interact, you still monitor progress.
Yes, and we ask patients, all patients, not only autistic ones, to stay in touch with us, to inform regularly about changes, what they observed. It can be each month, like report, video, call. In case of necessity, it can be more often, so it depends.
Okay. Now, here at Swiss Medica in Moscow, Do you use only stem cell treatment, or are there other types of therapies that you use here?
For children, we use as well speech therapy and so-called IMA treatment, intracellular metabolism recovery.
Now, what is that?
These are special substances that can improve metabolism of each cell and can increase the efficacy of the treatment in general. So the outcome is much better, and we had experience in our past when only the stem cells were used, but now we combine IMA treatment. It can be nasal drops to make it easier, yes, for children not to have regular stress because of infusions or injections. So it can be very simple, like nasal drops that activates as well neurometabolism. And synaptogenesis, the process when there are more connections between neurons.
Okay. All right, now let me see. So basically, just to summarize, the treatment only takes maybe 30 to 40 minutes, and you're monitored afterwards, obviously. But after the few hours of monitoring, is the patient and their family, they're allowed to explore, they have free time, they can, explore the city?
Sure, they have free time and they can enjoy opportunity of staying here, and almost all family, they could visit different children's centers after the process and different historical places. It's up to their choice.
Okay, now, as far as treatment, the actual program to treat autism, there's a long program that's recommended. Is that correct?
Yes, it is recommended to have several sessions, and now we have such a scheme, such interval between treatment should be 6 months period in general, and the family should come for, let's say, 4 or 5 days and have 2 stem cell procedures. As I told you, it's better to use umbilical cord derived stem cells, which showed high level of efficacy, and as well in combination with placenta derived stem cells. So totally for a period of 2 years, the child can have 4 sessions, and then for 2-3 years they can have long break and then see what happened and discuss further tactics, what to do.
Okay, excellent. Excellent. Well, thank you very much, Dr. Alexander. I appreciate your time. Thank you for taking the time to see this video. Again, this is Dr. Alexander, doctor at Swiss Medica here in Moscow, Russia. My name is Joseph Jerez. I'm a patient of Swiss Medica. I'm out of New York City. Thank you again.